Hello, we have Houston, Texas-based cosmetic surgeon Dr. Nikko joining us to answer a few questions regarding breast implants. And our first question comes from Jessica. She says, I've heard all types of things on implants. Which do you recommend and why?
Jessica, I believe I heard your question right. You read a lot of things on breast implants, and so let me just break down the important things that you need to know. There basically are two types of implants. There are the silicone gel, or the new one are called cohesive gel, and then you have the one that we've been using in the past, saline. Now, saline basically has they're filled with saline solution. Okay, so which is the same solution that we put into patients' vein when they go in the hospital. So if something were to happen to the implant covering, that saline would just disperse and go into your body as if you just got a bag of saline and nothing happens. Okay. Now the shell of the saline implants is the same as the shell for silicone implants. The only difference is that it's filled with a cohesive gel for the gel implant. Okay, some people will come in and say, I've heard a lot of good things about the gummy bear implant. So these aren't like the actual gummy bear, but they're pretty much the same thing, same technology. They're filled with this new gel that is a cohesive gel. And exactly what is a cohesive gel? Well, in the old silicone implants, if the shell were to break, let's say there's a slit in the middle, a hole or something, and you break it open, the silicone polymer would actually can drip down, and it can leak to other places, you know, around the tissue. Okay, now these cohesive gels, they stick together. Okay, so they don't run off, they stick together. So even if there's a break in the shell, these cohesive gels stick together and they don't migrate to other places unless there's a lot of force and a lot of trauma that forces these gels to other areas locally near the breast. And so there are those two types: silicone gel, cohesive gel, and then the saline implants. And then of course with the cohesive gel, there are different shapes, just like the saline implants are different shapes. So not just different sizes implant, but also different shapes. You have the very moderate profile, and then you have something that's a little bit more, that has more projections, the moderate plus, and then you have the high profile, and then you have the ultra high profile. So the different shapes can help us shape the breast into different shapes depending on what you like. So we have a few things that we can play with to really determine the outcome of the shape of your breast. It's not, in those days, it's simply just putting a device and we're making the breast bigger. If the patient's breast has a certain shape, there's only so much we can do, which is true, but with the different shape implants, we have more leeway to help patients obtain what they want.
This next question comes from Erica. She was recommended to you by a friend, but is concerned about cost. How much do you charge, and do you offer payment plans?
Yes, okay, so cost is a common question among patients. Now, you will, if you visit, you call 10 different offices, you will probably hear 10 different costs, but it's gonna fall into a price range. And you're looking at anywhere, I've seen it as low as, you know, $3,000 out of state to, I'm talking about silicone gel implants. And I'm gonna focus on silicone gel implants because, believe it or not, 95% of what we do now are the silicone cohesive gel implants because they're better implants. So I'm gonna focus on that. And so I've seen it as high as $8,000 or even $9,000. So we're above average. So for our costs, you know, if it's a normal breast augmentation, then we typically charge about $6,500 for silicone gel implants.
Okay, our next question comes from Nicole. My friend has had implants. What are those, and is it something you must use?
I'm sorry, I didn't really understand that question. Who What is
Her
she
friend
asking?
has had implants. I'm assuming gel implants.
Yeah.
She wants to know what those are, and is it something that you use?
Yeah. Now, again, gel implants are what I use, 95% of the time. I rarely use saline implants now because a lot of patients are, they've read and they know that gel implants have a much better feel. There's less rippling, and it gives it a better look. Okay, and so gel implants are what I use most of the time. Sometimes I use saline implants for people who still are hesitant about are silicone implants safe. So certainly we can still use saline implants. And to tell you the truth, before silicone implants were taken back into the market, we were using a lot of 85% saline implants, and I would say the majority of patients are very happy. So it's not like saline implants are just completely horrible. They're still fine in the right patients. If they have adequate breast tissues and we don't need to worry about rippling, they make really great implants.
Lisa asks, is it possible for implants to burst?
Yes, yes. Now that's called basically a deflation or rupture implant. Deflation doesn't really happen with silicone implants because the cohesive gel, again, they stay together. They stick together. They don't disperse like the saline implant. So, with saline implants, you would get a deflation because the saline is going to disperse, and you're going to get one side that's flat and one side that's still full. So you got to go in and fix it. Well, with these new cohesive gel, a lot of patients are going to be getting what we call silent ruptures, meaning there is a little break in the covering because it is a device. There's wear and tear; it can break. So with the break, a lot of people really don't know it though, because again, it sticks together and it's still confined within that capsule. So a lot of people still go on fine without it, without any problem.
Okay, Marie's question is, how long will an implant last? If it's only 10 years, do I need another surgery at that time?
Yeah, that's another great question. Now, to answer that question, I would tell you that there are physicians who say, on average, implants should last about 10 years, and after 10 years, you should get it replaced. I don't particularly agree with that because I have seen patients with 20 years, 25 years, and even up to close to 30 years implant with the old silicone. So, and they're perfectly fine, they're perfectly happy. So what's there to say that a person with implants that are 10 years is not gonna have another 10 years of a good life with it? I don't know. So to have a patient come in and say, it's 10 years and we need to replace it, really, it seems very unnecessary because if the patients are happy, there's no problems, then there's no reason to go in and fix something when it's not broken.
Okay, we have our next question from Jasmine, who says, what is the most realistic, natural feeling implant?
Jasmine, realistic, natural feeling implant. Now, aside from maybe fat grafted into the breast, I can tell you that with the cohesive gels nowadays, when done properly, when placed in the right pocket, they feel very, very natural, especially if you have a great outcome and the capsule around your implants are soft. They should feel very, very natural. It is very difficult to tell that they're fake breasts. The only way to tell a fake breast is they have a slight capsular contracture, but I can tell you that the cohesive gel implants gives it the really, really natural feeling implant.
Well, our final question comes from Laura, who asks, will implants increase the potential for any long-term health problems for me?
Yes. Obviously, with cohesive gel implants, there was a long study that we've been going through. I enrolled a study 15 years ago, and with the cohesive gel implants to follow up data. And really, aside from a very rare report of a very rare cancer in maybe 20-something patients somewhere in China, of a certain very rare type of cancer. So aside from that, there's no clinical evidence to link breast implants, even especially silicone implants, to autoimmune disease, breast cancer, or any other type of health problems that that we know of that as of today.
Thank you, Dr. Nikko, for taking the time out to answer these questions regarding breast implants.
Yeah, those are great questions. If you have any more questions, I certainly love to sit down and help you work through which implant works best for you, saline or silicone, and after that, which shape. Breast augmentation, again, it's more than just figure out, what size. We like to figure out what shape, because there are things that if you spend time with the patients, we do a lot of photoshopping and we look at pictures, and there are things that we can do to manipulate the shape of the breast. It's not simply putting a device and making whatever they have bigger. There are things that we can do to change the shape some. So if you have any questions or any particular question that may pertain to you, I would love to visit. You can call 713-960-1311. Thank you.